Hi everyone. In the last video, we talked about various nutrients in our food and its impact on health. In this video, we'll talk about blood sugars and its relationship to food. I'm Raju, practicing endocrinologist from the United States. Whenever we talk about diabetes or high blood sugar, many of us tend to believe that it comes only from the sugar that we eat in our food. That's why when a doctor says that your blood sugar is high, many of us ask the doctor that we don't want any medications and we would like to control it with diet. There are two kinds of blood sugar in our body, one that is produced by the body and the other that goes up after we eat. That's why when you go for a testing with a doctor, they will always ask you to come fasting to check your blood sugar and again come back an hour and a half after eating to check your postprandial blood sugar, which means the sugar that goes up after eating. In the last video, we discussed how if a person eats more food than their body needs, the excess food is stored as fat. For example, when someone eats 3 idlis when they need only 2, the third idli is stored as fat. So when we don't eat for whatever reason, the body uses the stored fat, converts it into glucose and uses as a source of energy. When we don't eat, the hormones in our body sends a signal to our liver to convert the stored fat into glucose. And this glucose is released into the bloodstream, which can be used up to make energy. The insulin hormone that are made constantly in our body helps to keep our blood sugars within a normal range. As long as our body is functioning normally, these hormones, the insulin and the hormone that makes blood sugars, they work in harmony and keep our blood sugar levels in the normal range. When the body is not producing enough insulin or for whatever reason the insulin is not functioning properly, then the glucose goes up even when someone doesn't eat. That's why we can often hear people saying that they haven't eaten for long hours and still the blood sugar keeps going up. So, knowing this information, what does a common person need to know? We have often heard someone saying to their doctor, I haven't eaten for many hours and still my sugars are high. So, what should such a person do? When they haven't eaten anything and the sugars are still high, what should we do? Now, a person who has type 2 diabetes, how can they control their fasting blood sugar, meaning the sugar that goes up without eating? 1, if they are overweight or obese, they can reduce weight to control their fasting blood sugar. Number 2, they can do regular exercises to control their fasting blood sugar. Number 3, they can take medications like metformin, which can control the fasting blood sugar. If none of this work, they have to take insulin. For patients who have type 1 diabetes, insulin is a life-saving medication. They cannot live without insulin. So they have to take 2 different kinds of insulin. One insulin to control their fasting blood sugar, another insulin to control their sugar after they eat. So just by controlling the diet, it's very, very difficult to control the sugar that the body makes. Now, the next question is, what kind of foods increases our blood sugar? Last week, we saw that our food has 3 different kinds of nutrients, macronutrients: carbohydrates, protein, and fat. Among these macronutrients, carbohydrates are the only macronutrient that will make your sugar go up right after eating. In the next video, we'll talk about what are carbohydrates, which foods have carbohydrates, and how much we should eat, and much more information. Thank you for watching this video. If you think this information is useful, please share it with your friends and family. And to get notification about our next video, please subscribe to our channel. Thank you.